Why does understanding scoliosis matter? First, you have to understand what scoliosis is. As mentioned in other videos, scoliosis is a lateral bending of the spine of at least 10 degrees with rotation. Now, understanding what scoliosis is and how it develops and how it progresses is critical to being able to understand what the best and most appropriate treatments are. Now, with any treatment programs, probably the most important thing to realize is there's no cookie cutter approach, and every treatment needs to be specific and customized for every single patient based on their needs and their desires, but also based on their spine, where they are in skeletal maturity, and the risk of progression. So all the treatments need to be specific for each individual patient. Then we have conservative treatment options and we have surgical treatment options. And surgery should only be done when all conservative treatment options have failed, or the spine or the curve is so progressive that it's pretty much guaranteed that they're going to end up having surgery anyway. So we have lots of different non-surgical or conservative treatment options, anywhere from observation to scoliosis-specific exercise programs to bracing. So when is observation an appropriate treatment? One is when the patient has smaller curves, typically less than 20 degrees in a growing spine. Once it gets over 20 degrees, especially when someone's still growing, the chance of that progressing become much higher, and that's when a lot of times doing some type of more active treatment like scoliosis-specific exercises or bracing becomes more appropriate. Or when you have an adult that has a curve less than 30 degrees, especially if it's not bothering them. Curves smaller than 30 degrees in an adult have much smaller risk of progressing. Once those curves get beyond 30 degrees, especially if they get over 40 or 50 degrees, they have a much higher chance of progressing, and that's when doing some kind of active treatment just to make sure that it doesn't progress or try to minimize the risk of progression becomes more appropriate. So in smaller curves, less than 20 degrees in adolescents, or even in juveniles and infants, those are generally curves that we can just observe. Or when you have curves below 30 degrees in adults, that's not painful. Those are curves where observation can be an appropriate treatment. So when is bracing used and how does it work? Well, bracing is typically used in anywhere from infants to juveniles to adolescents, or even in adults. Now, when someone is still growing, we use bracing typically when curves get over 20-25 degrees. And when we're using the brace in someone that is still growing, we're trying to control how the spine grows. Now, traditional braces done in hospitals and orthopedic centers, they just try to hold, they're kind of like a cast. They work by what's known as 3-point pressure, where they're squeezing the spine and they're trying to hold it in position and trying to prevent it from progressing. And these braces are typically an off-the-shelf standard brace that an orthotist may try to make some modifications to be a little bit more customized for the patient, but they're not true 3D customized braces. In adults, braces are used to help or try to slow the progression and to help decrease or eliminate pain. So what are the big advantages of a ScoliBrace compared to a traditional scoliosis brace? One, it's custom made. It's custom made for each individual patient using modern technology. Two, because we're not relying on the doctors or providers' individual arts and craft skills to make the brace, we can make sure each patient gets the perfect brace. If we have 10 doctors that are doing a ScoliBrace or ordering a ScoliBrace for the same patient, they're all going to get the exact same brace because we gather the information using technology, we order those braces similar, and then the design center will make that brace for that patient based off the information. You're not requiring the doctor to use his hands to make the brace. Thereby, we eliminate variations and we make sure that no matter which ScoliBrace provider that person goes to, they're going to get the perfect brace for their body. Because of the way we design them, the way they're designed, we put them in an actually 3D corrected or overcorrected position. Instead of just trying to squeeze the spine, the brace actually works by changing how the vertebrae grows. When you have a growing spine and you have some asymmetries, you're going to have more pressure on one side of the spine than the other. You have growth plates in these growing vertebrae. When you put pressure on a growth plate, it stunts its growth. So if you have part of the spine, like the inside of a curve where the growth is being stunted, the inside will not grow as fast as the outside. What we do with the brace is we take the spine and we put it in the opposite position. And we reverse those forces, allowing the part of the brain that was growing slower to grow faster, and thereby changing how the spine grows and getting the spine more balanced and correcting the overall alignment. There's a lot of different patterns patients can choose from, so the braces can be very stylish, or they can be made plain if they just want to put them in their clothing so they're not as visible. But patients get a lot of customization as far as how the brace looks based on the pattern that they're able to choose. Another nice advantage of the ScoliBrace is they open to the front, which makes it much easier for patients to wear. A lot of braces are designed opening in the back, which makes it very difficult. You can imagine if you have a child that's wearing a brace and it fastens in the back and they need help putting it on. If they go to school and they have to go to the bathroom, they take that brace off, or they have gym class or PE, then they have to put the brace on, and if it's really hard for them, well, the compliance is going to go down. Or if you're an adult and you don't have someone to help you put your brace on, and it's very difficult to put it on behind you, you're probably not going to wear the brace. A lot of times when we have senior citizens, people that have weak hands, we can even customize the brace so we're not using straps. We can use other technology that makes it very easy for them to tighten that up. So another advantage is just ease of use compared to other braces. Now, can chiropractic help with scoliosis? Well, there is no evidence in the scientific literature that shows that chiropractic adjustments or manipulation can do anything to impact like the future or how a curve progresses. Now, chiropractic care can be a really important part of scoliosis treatment. It helps decrease pain, it can help increase mobility in the spine, and help decrease the spine from getting rigid. It just can't influence those curves. However, scoliosis-specific techniques such as chiropractic biophysics and some in like Clear, those techniques do have some specific treatments that are designed to treat spine asymmetries and misalignments. And chiropractic biophysics and Clear, chiropractic techniques have been shown effective at helping reduce scoliotic curves and reduce pain. And those techniques specifically can help with scoliosis and how the scoliosis may progress over time, and which is completely different than manipulation on its own. So why is surgery often recommended? Well, one of the reasons is a lot of providers in the US that do surgery for scoliosis are not aware or not up to date on non-surgical scoliosis treatments. Another thing is there's not a lot of providers that are really experts in providing non-surgical treatment options. So outside of surgery, what options do we have? One, we have scoliosis-specific exercises. And there's a few of these that have been shown highly effective. Schroth, C's, and chiropractic biophysics are the rehabilitative techniques that have shown to be the most effective in slowing curve progression and in some cases reducing the size of curves. Now, what are some of the risks of surgery? Well, first thing with surgery, there's always the risk that someone doesn't survive the surgery. That is a reality, especially as someone gets older, there's an increased risk. They can have a lot of blood loss with surgery, especially fusions. They can have a lot of severe blood loss, and there's risk of having some neurological injury whether it's spinal cord or one of the nerve roots actually being damaged in surgery. Long-term, degeneration is a problem, especially when you fuse two segments. The segments above and below that fusion have to do extra work because the other segments are fused, and that leads to what's known as adjacent segment disease. Also, surgeries can fail. Just because someone has a surgery You could have problems with that hardware that was used in the surgery. And sometimes people are even in more pain post-surgery than they were before the surgery. So complications includes 1, not surviving the surgery, 2, having a neurological injury from the surgery, 3, having increased pain and degeneration post-surgery, possibly the hardware used in the surgery failing, and then maybe needing revisions or other surgeries following that initial surgery. So what's my approach to treating scoliosis? Well, in our office, we use both scoliosis-specific exercises and bracing, and sometimes just observation. It really depends on what's in the best interest of the patient and what the patient wants. Now, of the scoliosis-specific exercises of SCHRA, SEES, and chiropractic biophysics, we use all of those in our office. And there's a newer technique that's been developed called ScoliBrace. See, with any technique, there's always some things that are good and some things that are not as good. And ScoliBrace, people that develop ScoliBrace have taken the best parts of SEES, of SCHRA, and chiropractic biophysics, and they've combined those to create a technique called ScoliBrace. We do ScoliBrace in our office, along with giving patient at home ScoliBrace exercise to do. We have people that come locally, and a lot of times people that live locally, they come anywhere from 1 to 2 times a week, sometimes every month, and over time they may come every few months for a checkup on that. If someone comes from a long distance, they are coming from a neighboring state, they're having to fly in, they're driving from several hours away. In those cases, we can do an intensive scoliosis rehab program where we're seeing the patient anywhere from 2 to 3 or 4 times a day, and we're condensing that treatment down. And when we do that intensely, we can still get incredible results, just like if we were spreading that treatment over several weeks. The bracing we do with ScoliBraces are custom made, and we do more braces than anyone in Colorado. But with the bracing, we're frequently combining the ScoliBrace, because what the research has shown is doing scoliosis-specific exercises and bracing, when appropriate, gets the best outcome for the patient.